Hello, and thank you for joining me at Blood Cancers Today, ASH Roundtable. We're going to have a discussion focusing on MDS and anemia in lower risk MDS. I am Hana Safah, Professor of Clinical Medicine at Tulane School of Medicine, as well as the Director of Stem Cell Transplant and the Heme Malignancy Program at Tulane. Joining me are my colleagues.
Hi, I'm Jamile Shammo. I'm Professor of Medicine and Director of Bone Marrow Failure Program at Northwestern University.
Hi, I'm Andrew Brunner. I'm an assistant professor at Massachusetts General Hospital and Harvard Medical School in Boston, Massachusetts.
Hi, I'm Tiffany Tanaka. I'm an associate professor for the Division of Blood and Marrow Transplant at UC San Diego Moores Cancer Center.
If you also can share with us the real-world retrospective study of non-transfusion-dependent patient with myelodysplastic syndrome treated with Luspatercept. It's a healthcare claim database study, and they looked at the data or the results or what happened to patients who somehow, and I wonder how, they received Luspatercept before they became transfusion dependent. So can you share that with us?
I think that the real world data evidence can be very helpful at times because you may derive sort of hints as to the responses or perhaps even physicians' preferences and patients that may not have been included in the clinical trials. I think in that sense there's some benefit to understanding real world data. And in this particular analysis, there was essentially an evaluation of over 800 patients that were most of whom, I would say at least 2/3, were non-transfusion dependent, to tackle the question, what happens if you actually treated such patients with treatments prior to them becoming transfusion dependent? All of us like to have an answer to this question because essentially all MDS patients will ultimately become transfusion dependent. So why you wait, and would starting the drug sooner be more beneficial? So in this analysis at least, and we all know all the issues that may come with the real world data analysis, but it appears that patients who were receiving Luspatercept maintained other treatment immunity, if you will say. They responded and they kind of remained on this drug without needing additional treatment. And so the hope is that preventing, or I should say, starting the drug sooner in patients who may not be transfusion dependent may actually delay transfusion dependency. And I wonder what my colleagues feel, but I feel like this should be challenged and perhaps reanalyzed in a frontline setting.
Thank you. And I think there is trials now going on with Luspatercept, Dr. Brunner.
Yeah, no, I was going to say, I think it's a real challenge for us to try to tell the future. Would this patient have gone a year without needing a transfusion anyway? Mm-hmm. Or is intervening somehow changing the course of that? I think the data that we have from MDS in general that gives us some insight into that possibility is maybe the Sintra-Rev data, showing early intervention with low-dose lenalidomide for 2 years can delay the time to transfusion independence. But even with that data, I myself struggle with what's the best course of action for a patient. I think that my view of a lot of this data is that intervening early, not waiting until people become heavily transfusion dependent, not letting them start to mount the complications of red cell needs. If you intervene early with growth factor, if you intervene early with Luspatercept, they're more likely to work, they're more likely to get better responses, and those responses can be robust. And so I guess I view that kind of real world data as maybe not going to change my practice of now treating everybody who's transfusion independent, but not letting people become heavily transfusion dependent. Once they start to have transfusion, that should be a signal in my head that we need to initiate some sort of treatment change. And so I think, I guess I integrate the data in my practice kind of that way, that we have tools and we should be using them early in disease.
Yes, and sometimes what happens is that you see this patient who may have a hemoglobin of, let's say 11, and then 2 or 3 months later they're 10.5, and then 2 months later they're 10 or 9.5. So yeah, they're not transfusion dependent, but they are anemic, they are fatigued. So data like this may actually help in this particular patient, yes.
Perfect. And I think, as I said, there is a trial with Luspatercept looking at patients who are not transfusion dependent yet, comparing to placebo, and then we will be awaiting the results of that ELEMENT trial, right?